Hello everyone and welcome to this webinar. This month's webinar is a joint offering from the Scottish Funding Council Brain Health ARC and also NHS Research Scotland Ageing. So a very warm welcome to people that are joining us from either of those two camps. In the traditional way, I'm going to start just by telling you a little bit about what's happening in the ageing and the brain health research space in Scotland. I won't take long and then we'll get on to the main event, which is our speaker for today. But before we get on to that, there were a few things that I wanted to share with you. As always, I want to just remind you that joining the Brain Health ARC mailing list is free. You can go to our website, join up, and then you'll hear about future webinars and all of our other events. And I want to draw your attention to one of those events. Later in the year, we're going to offer a writing retreat. So we've had lots of feedback from clinicians and academics saying that they have great ideas, but they just never have the time to sit down and write. So we want to try and create some of that time. We've hired a really lovely piece of accommodation on the banks of Loch Lomond, and we're offering the people to come and leave their computers at home or turn off their email, turn off their phone and just write. And we're going to supplement that with writing surgeries, writing masterclasses, and one-on-ones with people who have a bit of a background in writing grants and writing papers and writing dissertations. So if that sounds interesting to you, have a look on the Brain Health ARC website and you can see how you can be part of that. For both Brain Health ARC and for NHS Research Scotland, we've been running a series of these webinars. We've had some really great speakers this year. And if you want to see any of those other webinars, again, they're all on the website. And for Brain Health ARC, we have our own YouTube channel. And once again, details are on our website. So that's all I want to tell you about what's happening here in Scotland. Let's move on to the main event, which is our speaker, Dr. Tom Welsh. So Tom Welsh has lots of different roles. He wears lots of hats, both in the ageing and the brain health space. He is specifically here because of the role that he has in various national and international special interest groups. So he is co-lead for the British Geriatrics Society Special Interest Group in Dementia, Delirium and Brain Health, and co-lead for the European Union Geriatric Medicine Society Special Interest Group in Brain Health and Dementia. And he does lots of other things in the space as well. He's an associate editor for Age and Ageing. He's the RRDN lead for South West Central, as well as still being a clinician. So he's going to tell us a little bit about some of the activities that he's involved with. Tom, it's over to you.
Thank you very much, Terry, for asking me to talk briefly on this. As you just said, I'm here primarily with the two hats of European and British Geriatric Medicine Societies. So I've called this Connecting Minds for Cognitive Health, a tale of two SIGs, just to give a bit of a feel for what we're all up to. So I thought we'd sort of briefly talk over the activities of each of those SIGs, some of the things we've got up to, some of the outputs, some of our current projects, and of course I'm going to end it all with a call for everyone to get involved, because the many hands make light work, and we've had some really productive and excellent projects over the last few years involving both of these groups. So I always think it's nice to start by thinking about the challenge that we all face, but of course when we think about aspects of cognitive decline, delirium, dementia, we know that health systems across the world are under huge strain. Care is fragmented. We struggle to get diagnoses. Diagnoses, when they happen, are often later than we should do. There's not much happening on prevention strategies, lots of talk, but not much moving forward. We end up working in these isolated groups. So a neurologist and a geriatrician in the same hospital might be looking at similar patients, but not really talking to each other. And really, I guess the fundamental and core part of this talk is about how actually bringing everyone together can really make a huge difference, because there's an enormous number of excellent clinicians and researchers doing fantastic work in this sphere, but we're all horrendously busy. And it's so hard just to find those brief moments where you can connect with colleagues and realize that we're all looking at the same problem from lots of different angles, and really sitting down and talking together means we can all make really useful progress for our patients. So I thought I'd speak very briefly about where I am for a few minutes. So a big part of my role is as research and medical director at the Research Institute for Brain Health at Remind in Bath. And there's a few little pictures of Bath and the Roman baths and a nice sunny day in Bath. And the thing that irritates everybody most is our delightful open air swimming pool. So I always show that in case we have a job opening coming up. It tends to attract people down here. But in all seriousness, so Remind UK is slightly unusual. It's an independent charity set up on the site of the local NHS trust, but separate from it. The charity's been running since the late 80s, and its primary purpose really has been research in the field of dementia and neurodegenerative diseases. So aiming to help improve diagnosis, but also to try and look in developing new treatments, not just drug treatments, but non-drug approaches in this whole area. I've got a little map just to show we are a very long way from you, down at the southwest, tucked away in a small county. But the clinic and the research pulls from a much wider area, of course, and we're closely embedded within the local research networks, and of course more broadly through the SIG role. So we're quite fortunate. We're located very close to a number of large universities that are involved in research in this area. We're on a hospital site where we've got access to advanced neuroimaging and a neuroradiology department that are really interested in dementia and neurodegenerative diseases. Very happily, we work closely with our colleagues in psychiatry and in neurology. So we've almost got that glorious triumvirate of the different specialities nearly coming together in one location, but not quite still, but we're nearly there. And of course, happily being located on the site of the hospital, but slightly different, means we get a bit of the best of both worlds. We get access to all those helpful services, but we're also slightly distinct, which means trial setup processes are a little bit smoother and faster than they might be within the NHS. So we've been involved in multiple different both drug trials and non-drug trials in this sphere. So anything from phase 1 all the way through to sort of post-marketing studies, but also some big, large-scale non-drug trials. So, for instance, the PRAISE trial we're involved with the University of Nottingham, but also some non-cognitive research. So some projects we've had ongoing with colleagues up in the University of Strathclyde, actually looking at medicines management in older people with sensory impairment. We're hoping to do a bit more work on that side of things, looking at how we manage medicines in people with cognitive impairment, and a rather interesting study where we looked at a randomized trial of air filtration in care homes to see whether it reduced the risk of respiratory infections with colleagues at the University of Bristol. So some of the trials we've got going on at the moment, here's a smattering of things. So as I said, variety of things all the way from phase 1 all the way through to phase 3, and our non-drug trials, as I mentioned, the air filters, exercise, snacking, which is always a popular topic, and the PRAISE study looking at tailored physiotherapy and occupational therapy input to people with mild cognitive impairment and mild dementia. We also try to do our bit to do some capacity building. We're a relatively small charity, but we've had a reasonably good run through of doctoral fellows and postdocs working with us. So Annika and Aaron, who both provided and conducted some really interesting bits of research in this area. So we're trying to do our part to build capacity in the future. We work, as I said, with local universities, with the medical students. We've got trainees here in various medical specialities who are involved in the associate PI scheme. Again, just trying to build that depth of research experience with colleagues, both in geriatric medicine, in psychiatry, and indeed in neurology as well. I always bring this up because I'm sure I'm contracted to mention that we developed this fantastic learning resource, which is free to access if you complete the course within 6 weeks. And I'd highly recommend this, again, with colleagues at University of Strathclyde. So this is looking at supporting older people manage their medicines better. So a really good learning thing here. And looking to the future, we're really interested, of course, in brain health. We've recently had a small pot of money to start a brain health service really focused on people who have no symptoms, who are worried about their risk of dementia, where we can try and do some individualized risk assessment and risk reduction interventions. This is very much at its very earliest stages, and I'm hoping that this is going to gradually snowball over the next couple of years. I'm hoping this is going to be a useful way of people looking at their individual risk, a way of facilitating access to early diagnosis, and hopefully a way of identifying folk who might be interested in taking part in research, potentially taking advantage of some of the latest biomarker studies to enable access for people with preclinical Alzheimer's disease. So, my apologies to my co-chair for the cheesy photos here, but moving on to the main event now. So this is just to remind me to talk about British Geriatrics Society Dementia, Delirium and Brain Health SIG. So I, myself and Rachel Thompson are the co-chairs of this group at the moment. We work with quite a large committee who are pulled from SIG members. The SIG has a number of different roles, but they, broadly speaking, sit within the realms of commentary on policy for the British Geriatrics Society as it relates to dementia and brain health. Any input that's required from specialist societies or from boards like NICE, and of course trying to push forward what we feel is important from a specialty group perspective. So we've got within the SIG colleagues who work as geriatricians, but also colleagues working in psychiatry and in non-medical specialities. So we have research psychologist, and of course my co-chair is Admiral nurse consultant by background. So we're really trying to pull all those different angles together, and I think that's where BGS as a body can be really powerful, because everyone's working from that MDT focus. So some of our current projects that we've got ongoing, we've recently really started to try and focus on in-hospital dementia diagnosis. There was a really good session about this at the last BGS meeting in Belfast, and we're trying to take some further steps from that meeting to push the agenda forward on that. So some work within the SIG, we're hoping to produce some perspective documents on that over the next 6 months, and hopefully an update at the autumn BGS conference to report on where we've got to, and also where we'd like to see things moving more broadly. We run a series of webinars, a bit like yourselves, obviously not quite so highly polished as the Scottish Brain Health Arc, but we've had a recent one which I'd suggest people might want to look at, looking at blood-based biomarkers in Alzheimer's disease, and this one here, which I include a link for, looking at education in the context of dementia, delirium and depression. Really well attended webinar and freely available to all BGS members. We provide input into the NHS England steering committee. I must confess I'm not quite sure what the situation is in Scotland, but you'll probably know better than myself there. And we've done a lot of work on developing a delirium e-learning resource. So that's now live and freely available to anyone who's a BGS member, and people who aren't. There are a small fee is payable, but then you're able to access this resource. Really helpful. A small selection of completed projects, so input into dementia guidelines NICE consultation, input into the SIGN dementia guideline updates from a couple of years ago, some work on World Delirium Awareness Days. We've provided a blog for BGS for that, some position statements on person-centered care, and ongoing input through some of these oversight bodies, such as the former Dementia Expert Advisory Group. It's now largely been subsumed into some of the work related to NHS England, and in the future, given that NHS England is being pulled into Department of Health and Social Care, we'll probably see that continuing in some form. So looking now more broadly, so to our more international sphere, the European Geriatric Medicine Society Brain Health and Dementia SIG. So things work slightly differently with EU GMS. So the SIGs there are smaller in terms of the number of people who participate, but participation is rather more active than it is with the BGS, where the membership of the SIG is very high, numbering in many hundreds. But with EU GMS, we tend to try and pull people in a more active sense into ongoing projects. Please do have a look at the website link there. That's a terribly cheesy photograph from last September, where we met in Valencia. So for this particular SIG, there's myself and my colleague Pinar Soisel, who are the co-leads, and Hannah Maria Roito, who's currently the secretary to the SIG and is due to take over as co-chair with myself in September of this year. So the focus of this SIG tends to be a lot on producing position statements or perspectives from a geriatric medicine point of view on developments in treatments for Alzheimer's disease or other aspects of areas relating to dementia and neurodegenerative disease and brain health. We also try and again link in with some of these sort of broader groups that are looking at developing brain health or consensus statements. We also try and provide input and linkages with other learned societies for Europe. So this is just a selection of some of the ongoing projects that we have at the moment. So we've got representatives on the Delphi panel looking at the intersocietal consensus diagnosis on dementia. We have a task and finish group that's in the process of being set up, looking at linking in with the Association of European Geriatric Psychiatry. So again, trying to look at that overlap between geriatric medicine and old age psychiatry, but from a European perspective. We're trying to put together some projects on brain health services and what they mean for older people, and what the impact potentially of biomarkers or new diagnostic criteria for Alzheimer's disease might mean for older people and older people's diagnostic services as they stand. We've produced over the years an enormous number of outputs, so forgive the tiny print here. This is not meant for you to squint at the screen to try and read all of these things. It's just meant to give a bit of a synopsis of the fact that the group has been highly productive over the last 5 or 6 years after it was reinvigorated by Pinar and by Susie Schenkin, who were both instrumental in bringing the group and making it incredibly active. So we've got a lot of outputs on behalf of the SIG. So a lot of our statements are on behalf of the Brain Health and Dementia SIG, and of course the broader EU GMS Society as a whole, which means from the point of view of people who are participating in the SIG, it's a really good way of contributing to some really important and helpful and impactful publications. I can't stress enough how fantastic it is taking part in this SIG, because we're pulling together enthusiastic colleagues from across Europe and the wider world, it has to be said, all of whom have got really interesting insights and really different takes on things. And I think that's where it's incredibly valuable, because we talk about siloed working, but there's a lot of country by country siloed working as well. And we can learn an awful lot from how different people approach different problems, even if that's just on the simple level of realizing that in other parts of Europe, memory services are predominantly led by geriatricians rather than psychiatrists, or in some other countries predominantly led by neurologists. But we're all doing the same job, but we're all taking it again from that slightly different angle, and it's really interesting to pull everyone together because it does create a different view on it all. I thought I'd do, if Terry doesn't mind, a brief little bit of advertising for EUGMS and BGS. So we've got the conference coming up in September, which is in Reykjavik this year. One of our submitted symposia has been accepted, so this should be a really interesting opportunity to hear updates from a variety of different specialists talking about novel biomarkers for Alzheimer's disease, novel therapies, but also what we do in clinical practice when we've got people who are on these medications. We've recently had our own webinar looking at the emerging blood-based biomarkers that was provided for us by Adam Dyer from Dublin, which is really good. That will be available on the website if you missed the events last week. Tomorrow, we've got a BGS webinar by a variety of different colleagues talking again about looking at how we can make better diagnosis earlier on, so a timely and accurate diagnosis, what we can do treatment-wise, and what we can do to try and push research findings into clinical practice sooner. We've got further things on a European front, looking at the European Academy of Neurology later in this month around the brain and balance, so looking at falls risk in the context of neurodegenerative diseases, and further excitement from a European point of view. The European Alzheimer's Disease Consortium is coming to Edinburgh in October of this year, so I'm sure we'll see a good gathering of folk there for that. And pre-advertising, they're coming to Bath, but not until 2026. So book your tickets now to avoid disappointment. So I think fundamentally what I'm trying to say by this is join a SIG. If you're a member of the British Geriatrics Society, you can sign up to the BGS Dementia, Delirium, Brain Health SIG. Costs you nothing. You'll hear about all the things that are going on. Really great opportunity to get involved. If you're a member of the BGS, then you're automatically a member of the EU GMS. You need to do nothing. If you want to join the SIG, you just need to send us a brief blurb and maybe a short CV, and we'll see whether we can get you in. That's just to remind everybody about the EU GMS future online meetings. We have them 3 times a year in addition to the in-person meeting and in addition to the webinar. So lots of opportunity again to get involved. And if you're curious, I'd say turn up, see what's going on, see if there's anything of interest. And I will stop wittering now because I suspect I've talked for a bit too long, and I'll pause and see if anything we want to talk about further.
Thank you. That's fantastic. So clearly lots and lots and lots going on. I've noted down a few things that just struck me, and I want to go back to the start of your presentation when you were talking about your own research group in Remind, and what struck me was the multidisciplinarity. So I saw physio trials, pharmacy trials, engineering, really interventions. Multidisciplinary is great, but sometimes it's difficult to bring them all together and speak a common language. You know, how have you found trying to bring those very disparate disciplines all together?
So I think it's fair to say it's not without its challenges. I've had, I guess, something of an advantage in that my early schooling in Nottingham, where there was a very heavy focus on working as part of a broader MDT, just means that I suppose I've always taken that as the natural way of doing things, and I feel almost more uncomfortable not having the variety of different specialities involved. And I think with such a large area like dementia and neurodegenerative diseases, it's so important that we've got all those different inputs. I suppose perhaps it feels a little bit madly geriatricianly to go on about it, but I think without that holistic view, it's very hard to see how things will move forward. And I think it's really important to pull everyone in. And certainly, I mean, for some areas, maybe it's perhaps less important, but I think particularly for this area of research, I think it's absolutely critical.
Yeah, no disagreement from me at all. Thinking about breaking down silos and bringing communities together, an interesting thing I think about the 2 SIGs are they bring brain health and dementia together, because actually I'm seeing in some parts of the world that they're moving apart. I mean, do you think they should be in the same SIG, and do you think there are advantages to having them in the same SIG?
I think they absolutely need to be in the same place, because it worries me a lot that we're going to see the 2 diverge, and that's a big source of concern for me. I think brain health and dementia, they're 2 sides of the same coin, and to tease them apart just seems, again, just to artificially start dividing things in ways that's not helpful. To my mind, brain health doesn't stop if you reach a certain age or you develop an illness. I mean, it's still got to be a key part of whatever pathways exist. So to my mind, they are inextricably linked, and I think to try and divide them is going to be unhelpful in the longer run. But I am worried that is what's going to happen, and I think that's where societies like BGS and EU GMS can really put out those sorts of statements that say these things are connected, they need to stay together, and that's where these societies and the SIGs can be really helpful. So we were very deliberate in adding brain health to both of these groups because of that, because we feel so strongly that they should be part and joined.
Yeah, I think it's absolutely the right decision. And often when I give talks on the Brain Health Arc and the other organisation that I lead, which is the Scottish Dementia Research Consortium, I talk about the constraining nature of the names, because the Brain Health Arc isn't only about brain health. It's about brain health across the life course up until a thing that we might want to call dementia, and including that. And equally, Scottish Dementia Research Consortium also includes problems with your brain that predate this thing that we call dementia, or another term of your choice. I think you're absolutely right. Another thing that impressed me with the SIGs was, sure, you're doing education, sure, you're doing research, but I thought the policy piece was really important. Now, that's something that might not be familiar territory for a lot of academics or clinicians. What have your experiences been of, providing opinion on policy or trying to shape policy?
Well, I mean, primarily where that's been possible has been where we've been invited in to provide input into NHS England, into the Dementia Steering Group, and look into the future. I think we'll be doing something similar with the Department of Health and Social Care, and that's partly, I think historically we've had some input there, but also looking to the future, it's so important that we get the geriatricians' input into those discussions, to think outside the brain, as it were, and to look at that more holistic picture, because we know that people with dementia are living with multiple other health conditions. They have multiple functional impairments associated with this, and not registering that is a problem, and has been historically. And I think it's not to do a disservice to our colleagues in psychiatry and neurology. It's just, I think it comes more naturally to a geriatrician to start thinking about those. And when we're thinking ahead to how policy might provide targets or other incentives for diagnosis, I think that's again where having a pragmatic clinician involved at an early point is really important, because it means we can start to get sensible targets or priorities and not falsely incentivize routes that lead to some unusual later decision making, because we all want to create the biggest impact. We want to keep people fit, independent, aging well, and I think that's where BGS certainly can provide a strong voice for those areas, in particular with dementia and neurodegenerative disease, because of all the topic areas, this is the one that classically breaks down that barrier between what might be deemed mental health and what might be deemed physical health. It clearly rides over both of those.
No, I think that's so true. And just to pick up on something you said, because it really resonated with me, and it's very much aligned with what I think, a clinician that's been working in the field and knows the field actually brings huge value to these discussions. And one of the things I often hear is, oh, there's no point in me joining the SIG because, I'm just a consultant. I'm not affiliated with a university. I don't have a big research portfolio. And actually, I would say people that have an enthusiasm and an energy and have that experience are exactly the kind of people you want to join the SIG.
Absolutely. And that applies both to the British Geriatrics Society and the European Geriatrics Society. I mean, in both groups, clinical input is absolutely essential, because and I should stress that these are not groups of researchers. They are not. Both groups are a mixture of people who are predominantly clinicians, really. Most of us have additional areas of work as well, be that educational training or policy or research. But all of us bring that clinical experience, which is absolutely essential to inform these other areas. So I would be very keen on pulling in more people. And the more active members we have, the better the quality of the outputs, the more we can do. And I know everyone's horrendously busy, as I said at the start. And part of these groups does involve sharing out. We all have these ideas about what we know would be really helpful, but individually we don't have the time, but as a group we can put things together because we can share that workload out. And I think that's where the real strength of these SIGs and these collaborative groups really lies.
Yeah, I think that's so true. And the evidence of that is in that very impressive slide of all of the publications that have came out, the EUGMS SIG. It really is impressive. I've got two last questions, really just drawing on your experience as a leader of the SIGs. I guess the first one is, when you're bringing people together, particularly around topics that can be quite emotive, you know, like new therapies in dementia, dementia care, you're going to get some differing opinions, and sometimes some fairly vocal people with differing opinions. How do you manage all of that within one SIG?
I think one of the things we always have to acknowledge is there will be differing opinions, and part of what we try to do is try to provide avenues for those voices to be heard. Because I mean, if we think about novel treatments for Alzheimer's disease, there are clearly people who are sitting at both ends of the spectrum on whether these are a really good thing or really not a good thing. And I think where the SIG can be, that the SIG is there really to try to provide a voice for these differing opinions, but always focused on the fact that we're trying to enable our patients to be able to understand what's going on, but also access the best quality advice. And I think knowing and understanding that there are differing opinions is in itself a useful thing to have. So I think we'd, as ever, it sounds like it's a bit of a boring thing to say, but we value differing opinions. It's not a single voice speaking at all times, and there are disagreements, and that's a very healthy thing. And I'd be more worried if there wasn't, really, because it would suggest that we're not getting all the right people in the room. Certainly, we had a very interesting discussion last September around the disease-modifying treatments for Alzheimer's disease. A little vote when we had our SIG meeting in for the UGMS meeting, and there was clearly a divergent opinion on where we were with that. And I think as a SIG, we try to provide the opportunity for both sides to speak on that. And I hope we do the same with the BGS. And certainly that's what we've tried to do during conferences, is allow both sides to be heard.
Yeah, fantastic. My last question is around developing careers and building capacity, because you mentioned building capacity a couple of times. So if we have someone that's earlier in their research or clinical career tuning into our conversation, what would be your advice on getting started, and how can a SIG maybe help that?
So we always have a position for at least one trainee within the SIG, and we very much encourage, if anyone's interested, just getting in touch. We're very friendly, so if anyone's interested, we're always happy to hear from folk. I think in particular when we're thinking about dementia and neurodegenerative diseases, I feel really strongly that we need more geriatricians involved in this area, and I'd really encourage people, if they're in training and they're thinking about what they might be thinking about as a subspecialty interest, this is a really interesting area to get involved with. The UK as a whole is a little bit unusual in having a lot of diagnostic services primarily run by psychiatry. In other parts of the world, it's a lot more divergent from that. And I think geriatricians have a big role to play and a lot to bring to those services. So I'm very much of the opinion that we need to see more people coming into this area and picking it as a subspecialty area of interest. Obviously, I'm a bit biased on that front, but I'm confident that our colleagues in psychiatry would be really very happy to see a friendly geriatrician face in their memory services, and not only there, but more broadly in older people's mental health. There's a real need for physical health input into a whole host of patients, and I think that's a big area that we could talk about for hours. But I'd really encourage people to look at this as an area of real interest.
No, I'm also completely biased, but I agree. I agree 100%. So I think we'll wrap up there. That's been fantastic. Thank you very much. I'll continue your plug and just say that the Brain Health Arc will be at Reykjavik, or at least I'll be there, but we've had lots of submissions from Brain Health Arc members as abstracts to the meeting. So there'll be some Scottish representation in Iceland, and Reykjavik is a fantastic city to visit. Of course, it's all about the science, but it is a nice city. So thanks, Tom.
Well, thank you.
If I don't see you before, I'll see you in Reykjavik.
Yes, most definitely.
Okay, bye for now. Bye.